All right, welcome everyone to the final education session of the Against Biofilm Beyond Clean virtual conference. Dr. Jim Stobinski has over 25 years of experience in perioperative nursing. He currently serves as the CEO of the Competency and Credentialing Institute, CCI, and the CCI Research Foundation in beautiful Denver, Colorado. If I had to personify Friday, it would look a lot like Jim, so it's my pleasure to turn it over to you.
All right. Thanks, Lindsay. And thank you. I am so pleased to be invited to speak. I love these Beyond Clean conferences. I love the technology, and they have done such a great job of adapting to this new environment. So to be clear, we're in a whole different style of teaching and learning here. And I'm actually in an outdoor room staring at the foothills of the Rocky Mountains here in Denver. So I'm outside. If there's any issues with the audio, just speak up and we'll make adjustments to that. And let's get started. So I'm going to talk about the future of credentialing. And this is information about me. And I'm not going to read this to you. I don't like to read slides, but here's my task today. I'm going to convince you about how all these presentations, all this technical information, somehow how all of this connects to credentialing and certification. You've had some impressive speakers. You've covered a diversity of complex and very technical topics. I'm going to give you a break. I'm not going to talk about biofilm directly. I'm not going to talk about sterile processing directly. I'm going to talk about credentialing, certification, professional development. All the information you've gotten in today, pretty daunting, tremendous amount of information. How do you keep up with all of that? It's got to seem pretty rough right now. It may be information overload. I believe that the future of credentialing, my topic today, is part of that solution, and that's what I want to communicate to you. So CCI does certification. The nurses in the audience, you probably heard of us. You may hold our credentials. So for us, we have to always show you this disclaimer. So we do certification. I'm going to talk to you about certification, but there's no special advantage if you're a nurse on the exam. There's no extra credit for listening to Jim talk. And we do have to show you this because it is an accreditation standard. So these are objectives. I'm going to talk to you briefly about the history of credentialing and how it applies in the operating room for two main professions, central processing and nursing. I want to talk to you about how professional development part of credentialing, talk to you about innovative education alternatives in certification and professional development, and then some alternatives to the traditional model. And right now, certification, well, it's a pretty standard model. You take some sort of exam, typically multiple choice questions, you pass the exam, we measured your knowledge, and then you get enrolled in a system of professional development in order to keep that certification. And typically that involves CE, continuing education. So I'm going to touch about alternatives to that and what we may see in the future. So the history of credentialing, only for 3 organizations and only for 2 professions, nursing and central processing. Nurses, hang with me here because this is not a nursing only presentation. This is about credentialing. And I sprinkle some of these historical images in here. It kind of gives us a sense of where we've come from so we can take a look to the future. So credentialing, this is one definition, but mind you, credentialing is a very broad topic. Credentialing covers certification, licensure, registration, continuous professional development. It all fits under this bigger topic. What we first know about credentialing started in about 1000 BC, and this was simply those people who were practicing what was then known as medicine. They would keep a record of their patients, and they had to be able to provide a list of patients they had treated that lived. So basically, if your patient survived, that was, being able to refer people or reference somebody that lived that you treated. That was the very first part of credentialing. We've come a long way since then, and really the modern part of credentialing and certification for nursing started in 1945, and then shortly thereafter for central processing. So this is the history of certification. This image that you're looking at, this is actually a hospital ship used by the military, I think about 80 years ago, maybe a little longer. But this is about the history of 3 organizations. First, let's talk about ISHM, because in the timeline, they actually come first. So the precursor to ISHM was the National Association of Hospital Central Services. That was started in 1958 and eventually evolved into ISHM. And in 1975, they offered their first certification exam. And in 1979, they started doing research. And in 1981, another significant event, that's when the Purdue course, the first standardized curriculum for central processing, that's when that started. And there's a lot of other courses now, but that was the very first one, and it started in 1981. ISHM is big. They have nearly 41,000 certificates, and they have 5 programs. And an important point here, their biggest program, CRCST, that is accredited by a group called NCCA. You're going to hear that. You're going to hear of that group again. NCCA and their accreditation processes is the common thread that connects our 3 organizations in their history. So they're big. They offer 5 certifications. This information was drawn last week, so it's very current. But you will notice they also have some other very specialized and much smaller certifications. The other ones that you see listed, and they even do credentialing for vendors that come to central processing. ISHM is a little different. They are a membership organization, but also a certification organization. They are very big into lawmaking and legislation. So this is a little bit different. CCI does not do lobbying, and we are not involved in lawmaking. So ISHM has a very active legislative agenda. If you went on their website and put in legislative map, you would see the figure on the side of your screen, this map of the United States. Those states that you see in kind of the purple magenta color, this is the manifestation of ISHM's work. In these states, you must be certified to be employed in central processing. This is New Jersey. Let's see. Yes, New Jersey, Connecticut, New York, and Tennessee, the ones in orange. In those states, which I think is Massachusetts, Pennsylvania, Colorado, in those states, they're actively working to enact these laws. So ISHM, to promote the profession, they work in lawmaking to make certification important to the profession and mandatory to be employed. To be clear, perioperative nursing doesn't have this. So congratulations to ISHM and central processing. you're way ahead of perioperative nursing in this respect. The other thing about ISHM is they have tremendous influence. They work closely with industry to formulate the standards about how we do things like sterilization, monitoring, decon. They work with industry and the people that build the equipment, develop the products to develop these standards. Those standards then are used by groups like the American College of Surgeons, the orthopedic surgeons, AORN, when they do their guidelines about sterilization and processing instruments. So a very influential organization. But now, the second on the timeline, Competency and Credentialing Institute, my organization. The very first part of the Competency and Credentialing Institute, that started with the membership organization, which is AORN, the Association of Perioperative Registered Nurses. AORN, they were started in 1949, but AORN did not start doing certification until 1978. They formed a separate organization, put up the resources. It was called the Certification Council, and they were tasked with developing a certification exam for what became known as our largest credential, CNOR. So, first exam offered in 1949, or the organization started in 49. The first credential, the first exam, 1979. So ISHM is already doing recertification, and the operating room nurses are just beginning to give their first exam. 600 plus nurses passed that exam in that first year, but now we have considerably more, and CCI is the largest certification in the world for nurses that work in the operating room. Eventually, there were some name changes, and in 2005, we became known as the Competency and Credentialing Institute, CCI. This is a little bit more about what we do. We have 3 credentials, and I talked to you about the common thread. CNOR is our largest credential, the oldest credential, and that credential is also accredited by NCCA, just as the ISHM credential is. We also have another accreditation body called ABS&C, which does only nursing programs. We also hold that for CNOR. And then also the CSSM credential for management is accredited only by ABS&C. There's an important distinction here. For accreditation, your credentials are accredited. So for ISHM, one of their 5 credentials is accredited and not the organization. So it's an important distinction. So CCI is not accredited. And also, to be clear, CCI is a separate organization. We're not part of AORN. It's a common misconception. For perioperative nursing, certification and membership, 2 separate things, 2 separate organizations. CCI, we also do certificates of mastery. We do one for perioperative educator, and we also do micro-credentials. And I'll touch on those a little later, but these are our current micro-credentials. We are just about as big as ISHM. Worldwide, we have a little over 40,000 that hold our certification. We're developing a new credential for ambulatory surgery. Many credentialing organizations are specializing, focusing on ambulatory surgery. So we are also. That one will launch in September. And then we're developing a new credential for nurses early in their career, but not a subject for today. So again, a little over 40,000 around the world. And then finally, the certification board for sterile processing. They're the other player, and they're the youngest of the 3 groups. They have 20,000 plus certified, but they also have the highest number of certifications. They have 8. So you'll notice these are the names here. And again, some of these are very small. Roughly the size of some of the smaller CCI credentials, because the numbers that you see there are the number of people that hold the certification. So mind you, on certifications, some people hold more than one. So the counts that you see are the total number of certifications held, not the number of people that are certified. So CB, SPD, they first offered their first exam 1991, and 3 of their 8 certifications are accredited. And they too are accredited by NCCA. If you'll notice when you look at that list, there's a fair amount of duplication between what they do and what ISHM does. Can't speak to the whole thing about competition, et cetera, but they do they cover some of the same areas with their certification. All right, so I do have to ask, I got a note about audio. Could we get an audio check? And if you could enter into the chat box, if there is any issue with the audio, if I'm not clear, if you could answer up now, and I'll pause briefly while I wait for people to answer. All right, so Lisa of the CCI team is also monitoring the chat box, as is Lindsay. If there are problems, just put a chat in, and I'll keep presenting. All right, so between these 3 organizations, they have issued almost 102,000 certifications. So we have a lot of influence between these, and we have a lot of people that are certified. So we have a lot of people certified, and part of certification, this whole big umbrella of credentialing, is continuous professional development. So let's talk about that concept. Continuous professional development, CPD, has a lot of pieces. That involves licensure, certification, recertification, lifelong learning, both structured and unstructured, and that includes the education that you pick up and the experience that you pick up in the workplace. So certification right now follows a pretty standard model today. Often, almost exclusively, it involves some sort of examination, usually multiple choice questions. It doesn't matter what field we're in, because the NCCA standards make us, make for many similarities between all of these programs. The recertification requirements, everyone uses continuing education CE. And then sometimes they actually promote CE, they produce it, they sell it, and CE is a big part of the system. There are other learning activities, but CE is clearly dominant here. But the important part to remember, all of our programs are accredited by NCCA. That's the common link between all of these groups. And these accreditation requirements shape how we do certification and then ultimately continuous professional development. So this whole thing about continuous professional development, this is where I see where credentialing can help. So if we think about all the lectures and presentations you had earlier today, and they were talking about a very fast-paced environment, a lot of science now in how we process instruments, the whole concept of biofilm, and how do we address this issue. There is a lot of information here, and it's not going to slow down anytime soon. Certification, continuous professional development has the capacity. This could address your learning needs. That's where I see certification where it comes in. It can assist you to keep current, and it can help you to enhance your competency. So in nursing, there's really two big parts, two elements in this whole thing. There's licensure, which doesn't apply to all the health professions, but it's part of nursing, and certification. But certification for nursing is not mandatory. But the goal, these two things come together, they reinforce each other. Your requirements to keep your license, your requirements to earn and keep certification come together. We assess your knowledge, we have you do CE, we have you do learning activities. The goal is to protect the public. That is very similar to central process, even though right now you don't have licensure. You may have registration, but you don't have licensure. The goal of certification, and we go back to the map from Isham, the end goal of that ultimately is to protect the public. And it's a great persuasive argument to say if you're certified and you engage in continuous professional development, you can help to provide safer care. All right, so let's talk, how does certification, how does this help to bridge the gap? How does this happen? So this is the key step here. We all enter our respective professions. You do some measure of training, the Purdue course, a perioperative training course, but you eventually enter the profession. Certification can help you to develop the knowledge and skills to be competent in your practice. That's where certification comes in, because they will ask you to do more things than will be asked of you in your workplace. And for nursing, more than they ask you to do for licensure, that's what certification brings us. It helps you to develop knowledge and skills, or at least it has potential to do that. As you develop in your practice, you have a more specialized practice, this is what it helps you to do. So, certification has potential to facilitate continuous professional development over the course of your career. But there's a couple of caveats to that statement. So let's talk about the connection between certification, continuous professional development, and competency, and how you measure competency. So there's one really big assumption about certification, licensure in the U.S., and this is particular to the United States. We make the assumption that if you have a current license or your certification is current, that you're competent, you can do your job and you can do it safely. That is a big assumption. Let's talk about these terms, because all of these things about competence, competency, continuing competence, these terms get battered around all the time, and some people see them as interchangeable. For accreditation bodies like NCCA, and as far as keeping up with the science and all the fast-paced change in your job, there are important distinctions. Competence refers to your potential ability, your capability to function and do your job well. We use certification and certification exams and licensure exams as a proxy for competence. Certification exams, by and large, measure your knowledge. They're a test, a knowledge-based test. So they can tell us if you have the knowledge and if you have the potential to perform. They can't measure what you do in your job every day. Competency, that's your actual performance. So that's more difficult, and it's harder to cover with certification processes. Continuing competence, this gets us to why do you do continuous professional development? This is to continue to develop over the course of your career. You work on this to maintain your competence and your competency over time. Continuous professional development. This definition comes to us from England, from nursing and midwifery in England, but it applies to all healthcare professions. Continuous professional development encompasses experience, activities, processes that contribute to the development of a healthcare professional. It's a lifelong process, both structured and informal, and I think certification and the future of certification, how it may look in the future, is where we can really help here. Accrediting bodies like NCCA, which all of us, if you're certified by any of these organizations, you're being touched by this. So continuing education, if you're either licensed or certified, you probably have some sort of requirement to do CE. It's long been used, it's easy, it's convenient, people understand it, it's easy to add it up, it's done in units. You just say, you have to fulfill 125 units in this time period, and people can understand this pretty well. These are the requirements for central processing for the two organizations. For CCI, for CNOR, you have to do 125 CEs in 5 years. So we're very used to these systems. Oh, here's the other caveat. We have used CE forever, probably dating back to 1979 with Isham, when they started doing recertification. But there's a limited correlation between doing CE and actually improving your practice. The Institute of Medicine did a report on this, and you can access this report at no charge. It's called, just look up this title, Redesigning Continuing Education in Health Professions. Put in Institute of Medicine, Redesigning Continuing Education in Health Professions, and this is kind of the background for what I'm telling you. You can download a PDF copy of this report at no cost. It's a benefit of being in the United States and paying your taxes. In this report, they tell us CE, as we currently do it right now in the health professions, really has limited ability to assess your actual practice. Think of this. They are asking you to take a class, read a book, read something, answer questions. They're not in your workplace watching you work. Accreditation standards from groups like NCCA realize this, and they are beginning to address this. This comes right out of that report. This one I'm going to read. Knowledge-based testing and the use of CE, which are staples of current certification processes, may be a poor predictor of actual clinical performance. You doing your job, it may not contribute meaningfully to enhancing competency. So we need to change. The accreditation agencies for all of us are going to ask us to change, and they're going to start dealing with competency, not just your potential ability or how well can you take a test, but your actual performance. There's ways to do this, and in the Institute of Medicine report, they outline this. There's different approaches, so we could get away from just CE and do things like peer-reviewed performance, include that in your evals, doing self-assessments of your learning needs, reflecting on your learning needs, and drawing up a more rigorous plan, and using alternatives, and I'm going to talk about some of these, to testing in CE. Some of those other solutions, what could we do besides just exams followed by CE? One thing that we're doing at CCI, you saw earlier there was another credential. It's the CNSCP credential for advanced practice nurses. We have converted that to a portfolio. And that is another way to demonstrate your competency. You assemble your work product, things that you do that prove that you possess competency, and they get reviewed by your peers and your certification agency. These are used in other professions. Teachers use them, architects, the performing arts, photography. They use portfolios to demonstrate their competency. So these can be accredited by NCCA, and ABS&C will accredit these. These are one example of another system not based in exams. You can also do assessment-based certificates, which measure all the components of competency, knowledge, skills, and attitude. And for these, they too can be accredited. And typically, the education content is more focused and narrow, but you could, in theory, do something on sterilization or decon or storage condition for supplies could be covered in a certificate of mastery. These too can be accredited by both NCCA and ABS&C. There is no recert here. It is time limited, and once it expires, you just have to do the course again. But they do have an assessment. There's some sort of testing method in here, which may include a practical skills assessment. That can be part of this. So performance skills-based assessment, we know how to do this. Behaviorally anchored rating scales, there's actually a program in perioperative nursing called the NICE program that makes extensive use of behaviorally anchored ratings scales. We could do hands-on evaluations. That's another way to assess your competency. And we can use simulation, which is starting, there's starting to be more and more simulation being done. So what else could you do for education besides just CE in continuous professional development? And if that sounds like there's a jet going by overhead, you're correct, because we're under one part of the flight path for Denver Airport. We're also near the Air Force Academy, so it looks like they passed, but let's talk about other education options. There is a thing called Moocs. So if you've ever heard of Coursera, edX, they provide massive open online courses. So these are based in university, well-known quality universities. Stanford, Yale, Harvard do this sort of thing. They're free. They're web-based, distance learning, large numbers of students, but they're internet-based. And these sorts of things can also document your learning and engage you in continuous professional development. Social media could be used to do this. And to be fair, this is probably the one that's most difficult to do, but it's also a possibility. These are the sorts of things you could do on social media. Right now, we're doing a webinar, but more interactive webinars where you have to participate and engage. That would be an example. Doing blogs, sharing tweets and getting responses. That would be something else that could be done. Then we have micro-credentials, usually web-based, portable, and these are how you could showcase your accomplishments. They are especially amenable to showcasing your skills. They are often connected to certification, but they can be used to demonstrate your competency. We have 2 of them right now, and in these, we can assess your knowledge, skills, and abilities, your attitudes, and those are all the components of competency. So using micro-credentials, which are more focused, a smaller part of the total knowledge it takes to manage an operating room can be covered in these. And they recognize achievements in your professional development. So how exactly do these fit in? How would they work? You could use them as an adjunct or a substitute for doing CE, because these can actually measure your competency. You could use them in job preparation to stack them up to ensure that you have all the competencies that you need to do a given job, like manage storage of supplies, sterile supplies, and they can be used for eligibility for certification and recertification. But the key, they're very flexible. They can be developed quickly. And if you think back to the ISHM slide and the other credentials, there are a number of very small credentials. It takes a while to develop an accredited certification and build up an exam and do all of that work. You could develop micro-credentials quickly. Certification organizations can do this because they have all the means to do it from doing test development. They're relatively easy to develop, and you can quickly address learning needs. So consider this. We have a problem with biofilm in processing endoscopes. We have issues there. This is a fairly recent development that it's really come to the forefront. You could develop a micro-credential, work with the industry, develop a micro-credential, and then quickly address this learning need and help the whole industry across professions to get better. Now, I'm going to touch on micro-credentials at the very end. So how do you document these things like certificates of mastery, assessment-based certificates? This is part of the future, too, when we talk about documentation. You can document these with digital badges, and increasingly in the world of credentialing, we're seeing more digital badges. This is an electronic version of your resume. You can visually capture your accomplishments. It is an icon, but it can also be an exchange of information. So if we consider digital badges, which is storing the information in the cloud, the most robust example is an open badge. CCI works with a provider called Credly, and I'm not doing a product pitch here. This is an example of one company that does digital badges. This is what it looks like. So these icons, and they're commonly used in IT and tech, they use them a lot. This is one individual mock-up of what his badges would look like. Each of these badges that you see are accomplishments, small bits of learning that he did, but it's a graphic visualization of achievements. Credly does the badge for you, but then if you have an open badge, all of this information is provided. If you choose to share the fact that you hold a micro-credential or a credential and it's associated with an open digital badge, all of this information you can share if you wish just by sharing your badge. It's secure, it can't be edited, it can have an expiration date, but in these digital badges, we can put the name of the organization that issued it, what was covered under the exam, your particular strengths, additional training that you've had, that you've also completed other certificates. All of these can go into the digital badge and exist on the internet. They can also facilitate a two-way exchange with an open badge. So in theory, an organization that's looking to hire in New York, certified central processing can push out advertisements to say, we're now hiring, and please contact us because we value your credential. This is the future of credentialing, that it's not just a database that shows you're certified, but all this rich data that can be connected to you in your certification, if you choose to share. So we're near the end. Where is CCI going? And CCI, but also where could ISHM in other certification bodies, where could they go with certification? CCI is in the middle of a lot of changes. We're revising our programs. All of the science that you've been exposed to, all of this rich trove of information and things that you need to apply in your workplace, this is a very fast-paced, technical environment that we work in when we sterilize instruments, process instruments, store supplies. This is a very technical field, and it's going to accelerate. Computers are involved. This is much different than when I came into the field 35 years ago. So we are strengthening our programs, changing our programs, and adding offerings so that we can keep up in this fast-paced environment. And we have to react to the accreditation standards. Right now, NCCA is in the middle of revising their standards. And they do this about every 5 years. If NCCA says you have to get better and do things beyond just CE and beyond just a certification exam, all of us are going to have to adjust to that. So the nurses, central processing, the surgical techs, all of us are going to have to do that. I think the future, we're going to have to go to more meaningful, continuous professional development. We're going to have to be able to document that over the span of a career. And we're going to have to look at things like social media, digital badges, certificates of mastery. We're going to have to look at other things versus the traditional model of certification exam and then CE for the rest of your career. If you want to know more about what's coming in the future, I wrote an article. It's in the AWRN Journal, and this explains a lot of this background in more detail. It's called CNOR Recertification. That's our biggest credential. Why continuing education alone is no longer sufficient. So that being said, if you want this article, I can get you a link to the article. I can give you a copy of the article. If you put your name in, and it goes to Lindsay or Lisa, who's monitoring the chat board, we can get that to you. But that explains the big overall picture. So we're starting new credentials, just like the other certification bodies. We're paying more attention to ambulatory surgery, and we're coming out with other credentials that deal with smaller segments of credentialing and certification, smaller pieces of knowledge that address more specific needs, smaller niches. We're developing a suite of micro-credentials. We're getting into the other things, assessing the other things, and helping nurses develop other parts of competency. It's not just knowledge, it's skills, it's attitude and ability. Those are all the components of competency. That's the future, to address all of the issues, not just knowledge, or all of the segments, not just knowledge. We're also doing remote proctoring. So we got to be flexible. I mean, right now, we're attending this conference virtually. Right now, if you want to take certification exams with CCI, you can do that on your computer at home. We're going to see more and more of this in the future, but you can do it at home, sign in. There's security requirements, but you can do it at home. That too is the future. There's rich opportunities here for people that want to volunteer and help us develop this. But the last mention of micro-credentials, we will soon begin developing a set of micro-credentials with Beyond Clean. We've made this announcement a while back. We started announcing this in March. We've already begun tentative planning for this, but we will have a suite of micro-credentials that's centered on the work of central processing. It'll be a collaboration between CCI and Beyond Clean, and the very important part, it'll be available to all the healthcare professions, not just nurses. This too is the future that we should work and learn together. This is one of the great things about Beyond Clean. If you want to know more about the science of why we do what we do in central processing, how do we sterilize instruments, how do we make surgery work, Beyond Clean has the knowledge and they can help to keep you current. Apparently you have an interest because we're all doing these webinars. We want to collaborate with Beyond Clean, take advantage of their expertise, and they have a commitment to the science and the evidence behind this. We want to develop more educational offerings, more credentials of different types, certificates of mastery, where all the professions can come together, even surgeons, for gosh sakes, if they wanted to join us, we can all do this together. We think this too is part of the future. So we have new partners. Right now, if you're a nurse and you go on your learning management system, you're credentialed with us, we have ISHM content right now on a website that they've shared with us. We have a partnership with ISHM because we realize their expertise in this area. Nobody knows more about sterilization and the industry standards than ISHM. NIFA, they do education for people, nurses that are surgical assistants. Beyond Clean, we have their podcast and educational activities from Beyond Clean on our learning management system. In the future, as early as the year 2022, CCI will have multidisciplinary credentials. We're branching out. It's not just nursing anymore. And this too is our future. You're going to see more collaborations here from groups like Beyond Clean, ISHM. We're going to all come together and we're going to break down the silos and we're going to work together. If you've ever attended a live event for Beyond Clean, we have all the professions there. We have industry there, surgical techs. We all learn together. It's a very rich learning environment. That too, I believe, is the future. So this is CCI's mission. We want to partner with our certificates, not only in their initial certification, but for their lifelong professional development. Our mission, we want to partner with like-minded organizations like Beyond Clean to further the future of certification. We think it's going to look different. We think there's plenty of opportunities for all the health professions who are willing to collaborate. That's what we see as the future. We think the future is bright for credentialing for those that are willing to take the risk to define the future. That concludes my presentation. And now I'm going to take a sip of water, and I'm going to rely on Lindsay and Lisa to set up the questions.
All right, Jim, can you hear me okay via this webcam?
Yes.
Great. Thank you so much for this great presentation, the great information that you shared about the future of credentialing. We did have, you can take your drink.
Thank you.
A couple of great questions that came in. For those of you still tuned in, if you'd like to submit a question to Jim, please feel free to do so in the question and answer engagement tool on your screen. Jim, I have a couple of questions to ask you. The first of which, could CSSM be explained a little more in depth, please?
Yes. So CSSM is right now only for nurses that are engaged in a leadership or management role in the operating room. Today, we just checked the numbers, Lisa, and we're now up to 330, and it's a wide diversity of leaders. We have nurse researchers, we have people that manage in central processing, they're nurses, people that do clinical managers, directors, vice presidents of surgery, those are the sorts of people. You do have to have a bachelor's of something to take CSSM. Doesn't have to be a BSN, but similar type of exam as CNOR. The questions are written in the same method, multiple choice questions, 150 questions, and the credential is good for 3 years. We demand a little bit more. These are leadership people. We ask a little bit more in a professional development to keep the credential, and it's good for 3 years. And we will be glad to send you more information if you want it. Right now, only available to nurses. You remember when I said in 2022, we're going to have a credential for multidisciplinary? It will be in leadership in the operating room, and it will be open to multiple professions, healthcare administrators, central processing. If you're in a leadership position somehow connected to surgical services, this will be open to you. So that's the next thing after CSSM is opening up leadership credentials for other disciplines. I hope that helps. If there's other questions specific to CSSM, ask them.
All right, wonderful. The next question, this is a good one. Will these 3 bodies ever combine to be just one?
In theory, I guess that's possible. But you know, each of these organizations is very strong on its own. If I had to predict the future, I would say we would work together so we can combine our strengths and help all of the professions that are engaged. That will probably be easier to do versus trying to combine them.
All right. The next question, actually more of a comment. Thank you so much. Very interesting content, all very useful. Another question that did come through, what about people who are certified through CBIC? Where do they fit into this for infection prevention?
Really? So, Lindsay, are you familiar with this credential? Because I am not.
Yes, I sure am. And that would be a great follow-up presentation, is to include some information on them as well.
All right. So is this, is it Certification Board in Infection Control? So
yes. So the Certification Board of Infection Control and Epidemiology is CBIC.
Okay.
CBIC.
All right. Now I'm oriented. Okay. So for CCI, here's the connection. I believe they are also accredited, and I'm pretty sure it's NCCA, but I can't speak for their organization. That credential is also useful in the OR, clearly. There are other people that do credentialing around the operating room. There is a credential called CASC for ambulatory surgery administrators. There's other credentials. I chose to concentrate only on 3. The one thing I will tell you, if you are credentialed with us, CCI promotes getting other credentials that will help you. So for us, if you earn or renew another credential, CBIC, their credentials would be an example, the ISHM credentials, the Certification Board for sterile processing. If you earn their credentials, we give you points towards your recertification if you earn or renew during your recertification period. So all of these credentials, wound and ostomy credentials, the credentials for nurses that work in PACU, all of those, we recognize the value. And they have high standards. They're accredited just as we are. And we actively promote that, encourage you, and we give you a break on our certification, our recert, if you hold those. So just because I didn't mention them does in no way speak to their value or their place in the profession. There's just a lot out there. These are the ones I know because I used to supervised sterile processing. So these are the ones I'm most familiar with.
Wonderful. Another good question came through. Do you think that central processing will become a degree similar to nursing?
Yes, I love this question. Lindsay, you know I've spoken on this before. So right now, there are a few programs that offer an associate degree that's connected to central processing. Most of the programs right now, and Lindsay, correct me, most of them are certificate or diploma programs, correct?
Most of them, yes.
Okay. So, but there's a very predictable arc here in how these develop over time. 50 years ago, the vast majority of nurses in the United States entered the profession with a diploma of nursing. And then eventually we moved to associate degrees, and now more and more baccalaureate degrees. I predict that central processing will go there in the future. Right now, for surgical techs, they're pretty strong on associate degree. The fact that that is one of the degrees that you can get into nursing, and surgical techs are promoting that as the standard, is not a coincidence. It's a savvy move. Well done by surgical techs. My prediction, I'll bet you within 10 years, you will see a lot of associate degree programs in central processing. The demand's out there. And besides that, kind of the theme today is there is a base of scientific knowledge you have to master in your profession. And I predict that's going to eventually manifest itself in associate degrees.
Another encouragement for the folks tuning in, definitely stay tuned to updates in the coming months and years from Beyond Clean related to that exact subject.
So, Lindsay, you realize one of my future presentations for you is Education is Changing. I will cover topics like this.
Great, great incentive for everyone who's tuned in to come to more virtual conferences through Beyond Clean. That's wonderful. All right. Another great comment. Thanks for the interesting presentation. I had no idea there were only 31 CNSCPs at this time. Glad to see that there are a lot of CNORs and CSP certificates of various types. Jim, you mentioned in your presentation the micro-credentials that are being worked on in collaboration with Beyond Clean. And our team is so excited to get those off the ground. And we're dedicated to making them intensive because our field deserves that. And so we're certainly excited for more information on those to come out. Is there anything else you would like to leave our audience with as sort of a final thought?
Final thought, let's just commit. If you're working in the operating room, let's just commit that we need to engage in lifelong learning. Doesn't matter what profession you're in, anesthesia, central processing, nursing, let's commit to continuous professional development and lifelong learning. Let's do the best thing for our patients. They deserve it. And so let's work together. I think the best education is when we all come together and we learn together. Thanks, Lindsay.
Wonderful. And thank you so much, Jim. On behalf of the entire Beyond Clean team, the CCI team, and of course our generous conference sponsor 3M, we thank you for spending your Friday learning alongside us. You will be able to view all 7 of these sessions on demand. So we encourage you to revisit them, reference them, share them with your colleagues, anyone who you think would benefit from this information that you've learned today. Take it with you, share it. We have more incredible conferences happening in the coming months, so be sure to follow Beyond Clean on LinkedIn, Facebook, and Instagram for any details. You can visit our website, beyondclean.net, and sign up for our weekly newsletter as well. And as always, thank you for listening to the Beyond Clean podcast. We're excited to bring you more subject matter experts and end users in that forum as well. We see you, we appreciate you, and we are in awe of the work that you do every day. And we'll always be here cheering you on as you keep fighting dirty. Until next time, thanks everybody.